The next member to speak is our gentleman from Texas, Mr. Crenshaw, for 5 minutes.
Thank you, Mr. Chairman. I'm glad we're doing this hearing. I think we need a lot more hearings on AI on multiple subjects. I think healthcare, utilization of AI in healthcare might be the least of our worries. I also worry that we're not always talking about this in an accurate way. We're not properly differentiating between advanced algorithms and AI. We're just saying AI. And that's not from our witnesses. That's just that's for Congress. That's for America. If we're going to properly regulate it, and I'm going to ask you what you guys mean by that. A few of you have said we need to properly regulate it. I'm genuinely curious how and what we do. But we have to talk about it accurately first. We mean machine learning. And we mean machine learning that you can't actually look under the hood and change. That's where it gets scary. If we're talking about advanced algorithms, look, people call Facebook and Instagram listen and watch my actions, and they make predictive analysis based on that. I've heard that used in tests like today and called it AI. It's not AI. You can change that algorithm. You can change how that works. Programmers can go in there and change it. AI, you cannot change. You cannot look under the hood. And so I think we just need to be really accurate about what we mean by AI. AI is meant to mimic a person. And that can be really amazing, especially for healthcare. And so I think things we have to talk about is, well, what data inputs go into that machine learning? Is it everything? That's how you get ChatGPT. And what kind of person is it mimicking? A good person or a bad person? This stuff gets really scary really fast. When we're talking about healthcare, it seems kind of obvious that you're going to limit the data inputs. Does that need to be a law? Is that one of the regulations that y'all are talking about? So actually, I'm going to stop there and ask you. A couple of you said that we need to regulate it, but I'm curious what you mean by that. Dr. Newman-Toker, maybe you could start because I know you said that.
Sure. Thanks very much. I think your question is very pertinent, Congressman. In terms of regulatory oversight, I do think that there are certain gaps with respect, in particular to diagnosis in this AI space. So I believe that, for example, if we think about direct-to-patient symptom checkers for diagnosis, where there's a legal disclaimer at the bottom that says this is not medical advice, but patients are taking it as medical advice, that it's really incumbent upon us to pay more attention to that consumer health space, as has been brought up previously.
So kind of like a digital watermark almost. Like I've talked about that before with respect to AI. Like it should be known that whatever this output is from AI, not a person.
Right. Not just that, but when people are making decisions about how and when to access the healthcare system, and it's based upon some kind of algorithmic decision making that's behind the scenes, there should be an accountability in that framework. And right now, there isn't any accountability to everything that exists outside the proper confines of, say, the hospital setting or a clinic. Before you get to the healthcare system, there's a lot going on that we need to regulate.
Can you give me an
better.
example of what you mean by that?
Yeah, so let's say that somebody types into their symptom checker that they're dizzy. And the symptom checker says, don't worry, it's nothing. It's little rock crystals in your ear, and
Okay.
you can stay home.
This is hypothetical, by the way, or is it not hypothetical?
No,
is there
it's not
something-
hypothetical,
Okay.
actually. There are a lot of symptom checkers that are out there. They've been studied
Got it.
pretty
Okay.
significantly, and they've been looked at, and their accuracy is often quite low.
And these are just websites I can go
Yes,
to. They're
and-
not FDA regulated.
Correct.
Okay.
And what essentially happens is that at the bottom, there's a legal disclaimer that essentially says this
Yeah.
is just a toy.
Yeah.
If you want real medical advice, ask your medical professional. But that's not how patients are dealing with that. And I do think that some of those decision-making, you may have a stroke that's causing your dizziness. And if you need to be sent to the emergency department, but this system, this AI system that's out there, unregulated, is saying to you, don't worry, just stay home, that's a real risk to the public health.
I think there's broad agreement here that we would never want AI to operate independently. Maybe not never, right? We might be in Star Trek mode at some point, but like, definitely for foreseeable future, that you would always have a doctor's blessing, even because there's amazing things that can happen. We're seeing this technology coming out of China, unfortunately, and this gets to a competition problem too, if we're going to overregulate things. But it's apparently diagnosing pancreatic cancer at 99% success rates. Like, whoa, that's amazing. Now, a doctor should still look at that after the fact and be like, yep, it is pancreatic cancer. But They're just amazing things that we can do with this technology. There's also amazing risks that can happen, especially when we're talking about that more generalized, generative AI, which is basically mimicking a person. And again, the question Congress has to ask itself, whether it's healthcare or any other conversation about AI, is what kind of person is it mimicking? We don't know the answers to that. And we have not talked about it enough in this Congress. So I'm glad we're doing this hearing, and I yield back.
Thank you. The gentleman yields back.